I think a lot of families with new babies sort of feel like they're being thrown out into the wild because it's such nobody's really prepared for it. I'm a pediatrician. My wife is also a pediatrician. We were both pediatricians when we had our first child. And I can't tell you how completely, totally unprepared we were. I don't think you get any closer to informed consent in having a baby than two pediatricians. But we were blindsided. Family Connects International is an organization that supports nurse home visiting programs for new families, so parents with newborns, whether it's a first baby or a 15th baby. It's always been kind of crazy to me that the United States has been an outlier in terms of providing newborn home visiting services. It's done in so many other countries around the world, and we know how impactful and effective it can be in mitigating a lot of the issues that we see that impact new families. These families need support, and being able to provide them resources, education, connection, so that they're not alone is better for everybody. So I know as a pediatrician, the system forces me to make visits shorter than I want. We're forced to sort of zip from one room to another, and we never get to spend enough time. I need all the help that I can get. And being able to partner with trusted resources like Family Connects nurses, with whom I also have a relationship, not only is it a second set of eyes and ears to help identify potential issues, bring questions to the fore, it also helps connect families to education, resources, and services that we don't have direct access to. It really makes our jobs better. We know that for every dollar spent on Family Connects, there are $3 saved in terms of healthcare costs, so it's a tremendous investment. What we know is that families who get services, who meet with Family Connects home visitors, have better outcomes. Those families have a 50% decreased risk of having to go to the emergency department in the first year of life. There's about a decrease of approximately a third in the prevalence of maternal postpartum depression, which is huge. And the impacts of things like that connection, really can't be measured, but are incredibly significant. Most importantly, if there are significant issues, if there are problems with feeding, if there are problems with weight gain, if there are concerns about medical aspects, that connection can be made immediately, and the family can access the necessary care required. Having a community actually care about supporting each other and providing the resources to families that they need to thrive and succeed, especially in those crucial first months, it's priceless.